What are you doing here after hours? The rotation's over. Oh, wow. Yeah, sure, I can take a look at you. Yeah, that's fine. No, don't worry about it. When I was in medical school, which is almost 10 years ago now, even though I look so young, there was a physician that I rotated with who was doing it was a family medicine physician who was in charge of the integrative medicine rotation and also did like palliative care. This doctor told me that as part of his interpretation of the Hippocratic Oath and the way that he understood professional courtesy, he always gave free medical care to medical students or family members of doctors. And I have, as you know, from rotating with me, I hate other doctors just because there is a lot of abuse in the medical community of many different forms. And then they're always like, oh, but you're a woman and you are allowed to do medicine, so you should just be grateful, which is okay. Anyway, so male or female, I actually, even though I publicly hate doctors, I actually really, really feel for my medical students. Again, male or female, whatever. So, all that to say, I will take a look at you for free. I don't have my cardiology 3 right now. It is in my bag. Yeah, I don't have a problem. I did see your grades after talking with one of your other professors. You did really well in my rotation. I'd be very willing to help you study also after taking this. So I have a very different schedule, as you've seen, because most of what I do is charity medicine, and after, with the PTSD, after being in the military, and which was really more related to things that I saw in medicine than the military itself. It could probably have happened outside of the military. But with that, and some of the fibromyalgia, which is another illness that old school doctors just are really behind the curve on, whereas modern medicine is just now starting to figure this out. Even fibromyalgia advice websites have things completely wrong and are way behind the actual curve of the research. So being somebody who has one of those illnesses that gets kind of despised, and plus a personality disorder, which physicians are so nasty to people with personality disorders. So being somebody who's a little bit outside of an outsider, I like outsiders, and so I feel for you, and I do have time to study with you. Also because since this is all IRL stuff that I'm saying, since I am transferring my medical license over to Paraguay, who do not accept American medical licenses, I have to take their licensing exam, so I have to restudy everything anyway. So yeah, no worries on that. We can study together. I'm totally serious. I'm going to little by little add study sessions that you can find in the playlist of this medical exam, okay? Let's examine you first real quick, and then we'll study together, okay? I'm actually really excited about this that I'm going to do. I had thought about putting all of the resources like as their own videos, but no one else will watch them but you, and I really do just want to be able to actually study with you and not make it like have to play medical exam otherwise. So, but right now we are going to do a medical exam on you. Tell me a little bit more about the palpitations. Okay. I'm just gonna type down over here. And tell me a little bit more about the headaches. Okay, when did they start? Do the palpitations and the headaches go together? other system symptoms while this palpitations is going on? Okay. Anything that happened right before? Well, there you go. Do you have a history ever of going to the doctor frequently enough that they become frustrated with you and lab results being negative? I am not accusing you of hypochondria, actually. And even if I were, I had a lecture one time when I was in residency by the rheumatologist who diagnosed me with fibromyalgia. And I remember listening to the lecture, and she said that, in the old days there was a saying that the graves are littered with hypochondriacs. Why? Because once someone is labeled as a hypochondriac, no one believes them anymore. So then they die of something because no one believed them. And she says she believes today the graves are littered with people with fibromyalgia who don't get diagnosed. And I can say, I'm really glad I had my appendicitis in Paraguay, because I at first wasn't believing myself, because the fibromyalgia pain is so bad at many points that I couldn't tell if this was appendicitis or a horrible, horrible fibromyalgia flare. And it was only when I started to notice, this is why it's so important to learn your physical exam stuff, even though everyone wants to rely on technology nowadays, because I couldn't really do a very good ultrasound of myself. My bowel ultrasound skills are not where they need to be, okay? Which is why I still have a preceptor, even though I'm 10 years out of medical school. I'm hiring a preceptor. Why? Because patient care is the most important. It's more important than our pride. So I was starting to do rebound tenderness on myself, and I was like, something is not right. And it was getting worse and worse, and I was like, fuck, I need to go to the hospital. Especially because I can't sit up and put my shoe on. I've had fibromyalgia episodes where I can't get out of bed, I can't walk around. But a friend pointed out to me later, she was like, it's on the right side. Well, the right side is the side you couldn't put the shoe on. That's right. So, again, learning your clinical science is so important, okay? Even though, yes, you can do a CT scan, and yes, you can do an ultrasound, these things make a big difference. So I wasn't going to go in. I told someone that morning, no, I've had gastroenteritis before. I'm never going to the doctor for gastroenteritis. And then, when I went into the hospital, the first doctor, and I don't like family physicians or ER doctors, even though I'm a generalist, okay? So those are the people that trained me. But there's just a tendency, ER doctors don't want you, they're tired of you if you're not doing XYZ thing. And if you're not dying, they're tired of you, and, that's all they care about. And that's fair. That's their job. So I don't mind ER doctors that much, because their job is to find out if you're dying. But they are the population that will miss something if you have fibromyalgia, depending on who you are. I had a very good ER doctor in the military who was my superior medical officer. And he, I don't think, would have let me die with fibromyalgia. But this ER doctor that I saw in Paraguay was like, yeah, it's probably gastroenteritis. And then he gave me medication you really shouldn't give somebody who has appendicitis, because sometimes they'll just go home and die. You're not supposed to give someone pain medicine. You're supposed to make sure the surgeon does the exam first. He kind of complicated the clinical picture by giving me something which could have made me go home and die. But the surgeon came in, checked my white blood cell count, so it was just mildly elevated, did his physical exam on me, and this was maybe one of the best physical examiners I've ever seen. He just was very careful and yet very detailed. Sometimes people just kind of push on your stomach and move on with their lives. He was very careful and checking each quadrant, checking each area, and measuring distance from my iliac crest to where my appendix should be, and just being extremely careful, right? And he was like, this is appendicitis. They operated, it was appendicitis, right? I really believe if I had not been in Paraguay and had those Paraguayan surgeons who also paid a lot of attention to me because I'm American, if that hadn't happened to me, I think in the United States I probably would have died. That's what I think. Just because my experience with U.S. medicine is, if you have fibromyalgia, get in the back of the line, we don't care about you. And I was still really at early stages heart was in this kind of the more edematous stage. So they caught it at a great time. I actually have my appendix saved in my house in Paraguay because I want to be buried in Paraguay, and if I die in the United States, I'm not going to pay to send my body to Paraguay. So now I have a piece of me in Paraguay that can be buried there when I die. Gonna bury it next to the well that is dedicated to my little brother who died a few years ago. So that's my morbid story. Yep, this is all true stuff. Yeah. Okay, so speaking of bellies, why don't I push on yours? Why don't we go to my, let me enter some more data in here for you, and then I think we just go to the other room. Okay? Alright, so your belly. Let's just kind of push here, and here, and here, and here. Okay, excellent. Now, what 2 mistakes did you notice that I made? It's better to percuss both and auscultate before you palpate. Yeah, surgeons will sometimes just go straight in and palpate, but it's generally better to do that. Yeah. So, no, I already washed my hands. Actually, when you were coming in, I was washing my hands, so that's fine. But yeah, we can do more like educational physical exams together. I mean, I would love that. I would have liked to have ASMR for medical students when I was a medical student, so now that I'm kind of being forced into this stuff again, because I have to reread the Harrisons and other things like that, because they're areas of medicine you just no longer practice once you've got your patient population that you work with. I mostly work with folks who have like chronic illnesses that have fallen through the cracks and kind of been ignored by traditional medicine. So I'm really up on my fibromyalgia and a lot of chronic pain things, a lot more than most other physicians I know. And I'm really up on my like care for people, like the multifactorial care for people who suffered sexual assault and things like that. My sexual health care, like I'm up on all that and all the related trauma. But there's other things like my ophthalmology, I've got to restudy, dermatology, got to restudy. Everyone has their strong areas and their weak areas, right? Based on what your patient population is. So it's kind of like a cardiologist generally does not remember any nephrology. This licensing exam in Paraguay, it sucks for like the specialists because they, even less than me, have been doing all the rest of the stuff, at least as a generalist, and because of my time in the military, I got that good, general exposure, but I still have to go back and like physiology stuff that I haven't studied in years. So, yes, you are quote unquote fine, but we're not going to stop there because you're not fine. You don't feel good. Right? I want to hear a little bit more about these palpitations. Do you ever have a family history of anybody passing out right after exercise, dying right after exercise, dying in a single car crash, or drowning with by themselves with no one around? No? Okay. Those are, reasons to look up hypertrophy, right? Yeah. Yeah, hypertrophic cardiomyopathy. Yeah, there's a hypertension related one, and then there's the genetic one. Yeah. So, yeah. Okay. And I'm not going to ask you how you feel after the palpitations because I'm not stupid. Obviously, I think just to be safe, we should do an EKG on you, right? Why not? It doesn't cost anything extra for me to do that, okay? So I'm going to have you lie down here, or stay lying down. Can you lift your shirt for me? Okay. So we're going to put all our V leads on. I have often conflicted with nurses. However, I've gotten along better with medics and paramedics that worked with me anyway. Somebody else's medics or medics that worked elsewhere were not always my favorite because they did not always do things the way my medics were trained to do, which which was to put the patient first above all things and not to see the patient as a nuisance. So I like my medics. I work well with paramedics in general. And I am sexist, unfortunately. I'm trying to improve that, but I tend to work better with men than with women. Something that I need to work on, right? Because we should be working together well. We should be looking out for each other in the medical field, right? We should be taking care of each other. But there is sometimes this cattiness, and I especially see it with nurses versus doctors. Just this like aspect of control where, again, the patient isn't first. If the patient is first, everything should be okay. All the debates I've had with people, it's like, if the patient is lying to me, or the patient is tricking me, or everyone thinks that I'm super gullible because I'm young and cute looking. But I'm actually not as young and cute as people think, okay? And I'm not the patient. The physical exam does not lie. There's actually tricks you can learn to check if they're malingering. Yeah, you can. Okay, my dear, so, yeah. Anyway, what I was going to say is, you can learn a lot. That like, admission about my bias, which I think it's important to know our biases, that admission about my bias aside, you really need to have humility when you work with allied health professionals, because they often have knowledge that doctors don't have, right? Or like ways to remember things. And it was actually a tech who kind of taught me even recently, like, you can always learn things. I know how to put on EKG leads, but sometimes I'll forget the colors and so forth, just because I'll become like, oh wait, yeah, it was this, because there's skills that now we've delegated to techs and nurses, and then we forget how to do. That's not okay. We should be doing things hands-on, right? Nurses sometimes don't like that though, because they feel like you're muscling in on their territory. But if I'm by myself and I don't know how to put on EKG, there's gonna be a problem. And a lot of techs, medics and stuff like that, are very happy to teach you, and you will find nurses who are happy to teach you too. My mother-in-law is an OB nurse, and I think she's good, a great teacher. So learn from your allied health professionals. In fact, I think medical education should be changed such that it's an apprenticeship system, and we should get rid of things like the MCAT, physics, organic chemistry, stuff that has not been shown via evidence to improve patient outcomes. Look, I love physics and actually enjoyed organic chemistry if it wasn't for the weird, like, nasty competitiveness they, like, worked into the grading system, because they were trying to, like, weed out pre-med students. They were so nasty. UVA has a terrible organic chemistry system where even if you've earned your A, which this wasn't a huge issue for me, but it made everyone super competitive, because even if you've gotten an A, your A isn't based on, a percentage, an objective percentage out of what you've learned. They're going to give out a limited number of A's to each lab pod. So during the year, you want to be screwing over your lab partner so that you rank higher. But then in the final, you want to be working together so that your lab pod gets more A's to distribute. That is so nasty, okay? People sometimes will sabotage each other in medical schools and on purpose give the wrong answer for stuff. It's a mess. Medicine is a mess, okay? Medicine is a nasty, nasty mess. So, I think an apprentice system would be much nicer, where right out of high school you start working under nurses and paramedics, and while you're doing that, half the year, half the week, and earning money, which also opens up opportunities for disadvantaged folks, right? You're learning that stuff on the job. You're working your way up, okay, to a medical assistant kind of degree, because there are apprenticeship programs now for medical assistants. You work your way up at the same time that the rest of the week you are taking your basic science classes, the basic things that you most need for medicine, okay? I majored in history. I believe very strongly in other academics, but the prerequisites for medicine should only have to do with medicine, right? With actually improving patient outcomes. Did you know that the ACGME grades you only 1/5 of your grade is based on patient care? What the hell is the point of a doctor? 1/5, an equal fifth, is based on systems management. In other words, should not fucking matter. What should matter should be your patient care. The other stuff should be under patient care, because obviously you need systems management to be good at patient care, but it should not be equal. It should be underneath that umbrella. So the entire system is fucked, okay? Just gonna be real with you there, because it's so dirty. So, in this apprenticeship system, you would work your way up half of the week. You're studying academics at a local college, something that you need for medicine, your prerequisites, and of course you can study things you want to study at the same time too. You can pick some classes, but the prerequisites for medicine need to be your apprenticeship so that you develop that humility of cleaning bedpans and you develop hands-on skills, and then you're going to naturally learn the system stuff along the way. You little by little work your way up, and then, eventually you're working with physician assistants, eventually you're working under doctors, you work your way up, getting your stuff corrected as you go along the way. You get through all your basic sciences you need, your college basic sciences, you get through your medical school basic sciences, right? Only the stuff that's proven to improve patient outcomes, things like anatomy, okay, obviously, biochemistry, obviously because you need it for pharmacology, obviously some of it is obvious, some of it not as much, right? Only the stuff that is evidence-based for patient care, not just because our ancestors did it, right? Same with the USMLE. Did you know there's no evidence that people score higher provide better patient care? Same with board certifications. Why are we doing anything that does not improve patient care? What is the fucking point of a doctor? Sorry. Okay, I want you to know this as a medical student, because you're the future that's going to change medicine. And if you lose your hope before you get there, which is very common, because there was another study that found third-year medical students, they surveyed them about how they feel about their patients, surveyed attendings, surveyed interns. You lose your compassion, actually, and start to see the patient as the enemy, the way the system is. So by the end of the system, you no longer have the compassion you had as a third-year medical student. We're actually, instead of taking people and improving them, we're actually taking people and destroying them, right? Around third year of medicine and up is when you start getting that 70% higher ending one's own life rate, okay? As in physicians have a 70% higher of that rate than in general other employments, other jobs, people in other occupations. This is not okay, okay? How can you change it? Because I don't want you to feel like you can't change it. You can change it, but you need to do well, and you need to do better than I did, right? I left residency to deploy because I was getting really sick, and I knew this fibromyalgia is going to take me down. I want to be a real soldier. If I don't deploy, I'm not a real soldier. Also, I actually don't believe that this residency is going to have my back to actually take care of patients. There was an incident that made me realize, there isn't an actual safety net here. I'm always going to be, the intern is always the one whose fault it is at that residency, which it should be the attending is responsible for the intern. So if something goes wrong, unfortunately no one was harmed or anything, but I was like, wow, okay, so I don't actually have anyone checking my work in a way that's gonna protect patients. So what am I doing here? I need to go study and get better on my own. So because I thought somebody else was checking the antibiotic, it was a really simple thing. I thought the person above me at night was giving an antibiotic. They thought I was. The attending was supposed to check and make sure. We all should have checked. I was the only one who took responsibility, did an M&M report, and was like, yo, we did not check the antibiotic for this person. Fortunately, they had RSV, so they didn't need an antibiotic, and they were fine. But if we had been correct in our initial diagnosis, this could have been a bad situation. We would have caught it because we would have seen, because I was checking him every single day, we would have seen him worsening instead of getting better. But, what was unnerving to me was that I was the lowest person on the totem pole, and I was the only one who took responsibility. And it was like, all right then. And then somebody else lectured me for, it was frustrating when I would give a patient what they wanted and somebody else would be against it. Even though it was, evidence-based that it was, good for the patient or was like ultrasounds a patient would want to see their baby longer, and they'd been waiting for a long time, and people would be frustrated that I gave the patient that time, even though I wasn't holding anyone else up. The nurses had already gone home and stuff like that. So, and the patient wanted it. But things like that just made it very clear to me that, okay, I'm going to be judged for being sick. I'm not going to be able to deploy because I'm sick. And I'm not going to be able to, I can't guarantee that these people who are supposed to be, like, having my back, and many of my attendings were very good, all of them, except for one, were very intelligent people who gave of themselves and did care about patients, but there was a lot of just ideological control. So one of them was, I had some amazing attendings. It wasn't their fault, it was the system. The system just kind of pushes you in certain directions. So I left residency in good standing my second year. I have all the documentation that shows it was good standing. The system was so toxic. Again, not the fault of the attendings, not the fault of the director. The way the system is kind of set up, the system was so toxic that actually 2 of us left in good standing second year, and one of them is not going to be a doctor anymore. Imagine this, like, he's worked as a doctor because he was a GMO before he went to residency. He's worked as a doctor. He's gone to residency. He's worked all through medical school, and now he's decided, you know what? This system sucks. It's not worth it. It's not worth it. So he's actually doesn't want to be a doctor anymore. He's going to finish out his military time and move on with his life, is what he said. So we're worsening the doctor shortage too. I'm in contact with a couple other folks from my medical school. Both of them were like, don't really want to be doctors anymore. Young, used to be fairly healthy, and fairly healthy except for what medical school and residency has done to them. Very, and don't really care about this anymore, right? So, you have to do better than us, and you have to survive what we and other, because sometimes young doctors are the worst, you have to survive what we and other folks are doing to you, unfortunately, okay? It's not hopeless, actually. I am still in medicine. I'm quite happy. My health makes it such that I can only practice a couple days a week, safely. I have to, because it's not really safe to be making patient care decisions while you are, like, on your back and much of your brain is taken up by pain. There's never been any evidence or anything that my patient care is affected, but I don't want to I'm not going to roll those dice, right? I'm not going to be like, because I know that I'm the only one I can trust to check my own work. So if my brain isn't quite working, or I haven't slept, unless it's an absolute emergency and I am needed or that person's going to die, I'm not going to roll those dice. I'm not going to make a mistake just for my pride. I'm going to do perfect medicine. Because I'm not going to be like those people above me who roll the crap down the hill. I'm going to take responsibility, okay? Because it's my patient. So, right, but that limits me a lot because there are days my body doesn't work. If you are healthy, you need to stay healthy. You need to make sure you're doing things for yourself. Eating well. I know it's hard. Everyone gives you this fucking lecture and it's so annoying because they've set up a system where it's impossible. I was once, when I was really sick, forced to go to a wellness activity at which I just lied down, and then I was judged for being lied down because I was in pain and sick, and I wanted to lie down at home, but they wouldn't let me because I was forced to go to this wellness activity. My wellness activity made me more sick. Okay. I did win a trivia battle at the wellness activity, but yeah. So I'm not saying that. I'm going to be realistic and say you need to grab tiny moments each day. Tiny moments where you have something saved up at your desk for yourself, right? Something that's actually healthy, not chocolate, like a tiny bit of tea or unless it's absolutely pure dark chocolate. A tiny bit of tea, a tiny healthy sweet bits of coconut, bits of mango, something that you enjoy, and lots of water. Carry water around with you. And right before you go in that patient room, take moments for mindfulness, take a deep breath. Come back to the moment, notice on what you're feeling right now. There's no grades, there's no preceptors, there's nothing but you and the patient. When you listen to that heartbeat, you listen. You take a deep breath, you listen, you breathe with that patient. That is the only thing that exists in the world, is that heartbeat. Okay? You do that. You take those moments and you hold on to what you believe. You should do DBT Value Living Questionnaire. You should probably read Viktor Frankl's Man's Search for Meaning. You should get in touch with the questions about faith, the universe, a God or not a God, because you're going to come face to face at some point with death, unless you are just rarely sheltered. Some of us got to come face to face with death earlier because we had more dire patient populations. But at some point, if you are smart and honest and not just a blind, dumb automaton, you're going to come face to face with these things, and you need to have your loins girded. You need to have your armor on, and the armor is not a wall of not feeling, because then that makes you unable to feel for and take care of your patients. It needs to be actual resilience, so that you can use feeling to your advantage, so that you can turn it off, focus on the moment, not turn it off, but focus on the moment when you need to, and then let yourself feel when you need to. Make sure you're not all welled up, and use feeling to kind of sense what's going on with the patient as well, to kind of listen to them and understand what their concerns are, because that's going to improve your diagnosis. Okay? That's going to make you able to hear what they're asking you for help with. I've talked a lot, and I actually have to go, but let's finish up here with you. Okay? You can change this. All you have to do is survive in well enough form that you still have strength at the end of this journey. And then you go into the AMA, you go into the ACGME, you go into the LCME, okay? And you change things. Or you do what some of my attendees did in Puerto Rico, and you boycott early. I don't know if this would work in the United States, because there's a lot of, I don't know, in the US we have things like Pinkertons. But in Puerto Rico, my attendings, who used to work there a long time ago, they, yes, Puerto Rico is part of the United States. Yes, it's not Caribbean medical schools. Yes, they do the American medical school system and are accredited by the LCME, not Caribbean medical school. Blah, 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 blah. Okay, we've gotten all that out of the way. So, the hospitals were in such bad condition that there was no, what do you call it? There was no, there was no protective equipment, no PPE. It was terrible unsanitary conditions for the patients. Residents were working hundreds, they were definitely working over 120 hours a week. And then on top of that, they were getting paid $500 a month, so they're starving, overworked. Their patients are suffering and dying. And so what they did is they were and they kept asking for things and not getting it, so they boycotted. They left the hospital. They all got kicked out. The chief resident, everybody else. The attendings then had to come into work. And oh my gosh, you know what happened? Yes, there was no PPE. They got the PPE in. They saw what the conditions were actually like. And they knew they couldn't survive without the residents. All the residents got reinstated, chief resident and all. So sometimes collective bargaining really works. But you have to have enough people who are willing to realize that this short-term loss is going to cause a long-term gain. And that's hard. That's hard and scary. Because you're putting it all on the line at that point. So, you can try to do that, you guys. Or, you can try to work your way up and hope you haven't lost your soul by the time you get to the ACGME level. Okay? But, you said an outsider, so I don't have the teeth in the right parts of the hot dog to rip it off, right parts of the flesh to rip it off. What on earth am I saying? It's really, really easy for an outsider not to, I'm an outsider, so, and I'm going to Paraguay to help people who are in need, and I have to work. My goal is to become an insider there, where I hope I can make a stronger difference, just because culturally I fit in well there. It's very difficult for me in the United States. It actually always has been, since I was a little one. I believe in you, and the changes you can make can improve patient care. You just have to be careful not to become arrogant and willing to bulldoze those who disagree with you, because that's one of the scariest things that we have in medicine right now, is anyone who disagrees with the party line is getting stepped on. And you know what? That's actually not how medicine advances. Medicine advances because outsiders do things. That's why the first heart surgery was done in South Africa, because at that point the United States was already so closed off, we were unwilling to advance medicine. Okay. So, even if what someone says sounds absolutely ridiculous, test it first. Randomized controlled trials and everything. And don't ostracize fellow physicians because it sounds stupid or wrong to you. Because that's how this mess begins. And there are going to be some historical videos about that down the line, but you can check out the one about osteopathy and the United States system. It's in the video about Malawi, the second Malawi video. It should say something like osteopathy in the title, but it might not. Alrighty, my dear. I'm glad. I hope you're feeling a little better and a little fired up. So here's the deal. Your let's finish up this EKG. So the leads, green goes over brown because trees go above the dirt. So that's kind of cool, right? And smoke goes over fire. So black goes over red. That's what the tech taught me, which is cool. And of course the V leads are easy. Put the V leads on, put the leg lead, so far. Arm lead, all the good things. Alright, so we'll run this. It's an old medicine, so it clicks a little bit. Alrighty. Let's see this print out. This looks good to me. Yep. We'll go over EKGs in detail later together. So, my dear, I think you're right. I think you are having stress-induced palpitations. But again, we don't want to ignore them. The vitals that you put into the computer for yourself. Did you take your own vitals before seeing me? Alright, cool. To tell you the truth, they look good to me. Yeah. Okay. Yep. And then since everything else is negative, I think we can observe you. However, if this happens and you have chest pain at the same time, I think it's worthwhile to get tropes just to rule things out. Obviously, since it's not happening right now, what we did just now was just kind of check for baseline arrhythmias. And this stuff can produce all kinds of changes. This stress, it can produce cardiac changes, all kinds of things. So do what I told you. Fit in what little pieces of healthy rebellion you can in the day. I'm not going to tell you to do some other grand wellness thing. Oh, you have to exercise, you have to eat healthy. They don't let you do that. Fit in what you can, which is going to mean being strategic, tiny little things next to your desk, biking and showering at the hospital, things like that, if you can. Okay, I so believe in you. I kind of want to order on you. Is it okay? Based on some of what you told me. Okay. Sorry I talked so much. Some people hate it. I've had people make fun of me on the ASMR channel for talking so much because they are assholes. Okay. Yeah, we just did a really quick one. We should do a more detailed physical exam at another time. Actually, can I feel your pulse on both sides? I just want to make sure it's equal. And then here. And here. Okay, can I listen to your carotids actually? My cardiology 3s and my go back, so I don't have a bell. But it's usually you're supposed to listen to the carotids with a bell. Okay. And now your tummy should have calmed down. It's been a while since I poked it, so just take a listen there. And there. Okay. Any nausea, vomiting, diarrhea, black stools, bloody stools, floating, greasy stools, white stools, green. A lot of poop questions. Difficulty urinating, any pain, burning when you're urinating, blood in your urine, anything like that. Okay. Yeah, any skin changes, unusual weight loss, rashes, night sweats, fevers. Okay. Any eye pain? We already asked about photophobia. We already asked about auditory changes, ear pain, anything like that. Okay. Any muscle drooping, and by that I mean like you find you can't, not just that you feel weak, but like it's grown one side, or when you know, some things will just drop out from under you. Any loss of bowel or bladder control. Okay. And okay. Alright. I'm gonna let you go. Eat. When you come back, we can study together. Does that sound good? Okay. I think in this thread, I think we're gonna maybe start with the Harrisons, but we may start with anatomy, okay? We'll see. Alright. I'll try to organize playlists in such